DLL3 is a potentially important target. So DLL3 is a protein that's involved with a molecular pathway that is often active in neuroendocrine stem cells and is often active in the protein is made in small cell lung cancer. So the DLL3 protein is generally not expressed on the normal cells in our body, but it is expressed in about 70% of small cell lung cancer. An antibody drug conjugate called RoverT had activity when targeted against DLL3, but through a combination of modest activity and some significant toxicity, it hasn't yet gotten over the hump to get an FDA approval, but certainly has shown promising activity. But I think it has validated DLL3 as a target, and that now is being looked at for bispecific antibody therapy, so-called BiTE antibody approach that is being pursued by some pharma companies. And it also is looking like a good target for the CAR T-cell therapy, which has been shown to be active and is standard therapy in some leukemias and lymphomas. So I think DLL3 is a target. PARP is a target. So PARP is an important enzyme in DNA repair, and DNA repair is important for cancer cell growth and survival. It's also important for presenting, potentially developing antigens that the immune system could respond against. Including PARP inhibitors with chemotherapy has shown some promise, but not enough promise by itself to get an approval. So if you look at chemotherapy with or without a PARP inhibitor, there's not enough benefit to get approval by itself, like for Empower 133. So we would have to identify either a biomarker to identify the patients who are benefiting the most, and there's a biomarker called Schlafen that looks like it might be that biomarker, but that needs further research. And there's also some research looking at PARP inhibitors with a chemotherapy called Temodar that looks promising, and also some research, especially preclinical research, looking at PARP inhibitors with immune therapy that looks promising.